Hello, my name is Dr. Donald Thomas, and I'm a rheumatologist in Greenbelt, Maryland, and I have a really exciting thing to do right now. I want to unbox my new edition of my book called the Lupus Encyclopedia. This is really exciting because I have literally spent thousands of hours, probably over 10,000 hours over the past 6 years. I started out in May of 2017, and finally the book has arrived. So let's open it and see what it looks like. I'm all excited. Okay, here we go. This is the new edition of the Lupus Encyclopedia, a comprehensive guide for patients and healthcare providers. So now, if you have the first edition of my book, you may be wondering, is it really worth it to get the second edition? And my answer is yes. There's lots of reasons that you should get the second edition. Here's a close-up. Thank you, Gary. So first off, you notice that it says healthcare providers. So the first edition, I had a lot of non-lupologists come up to me and tell me how they were using the first edition to help them manage lupus patients better. And so we improved the second edition by including even more management strategies that doctors can utilize, but also in simple, easy to understand language that patients can understand as well. So you as a patient can understand what the doctors need to be doing to take better care of you. So that's one huge advantage of this book. Also notice it has the Lupus Foundation's seal of approval. So the Lupus Foundation of America also is backing up my book, which really makes me very happy as well. So the goal of this is to help patients be able to take care of themselves better by putting it in easy to understand language. And first, let's go ahead and open it up. And I better put on my glasses. All right, because I do want to read a couple of things. So first off, let's see, sorry for the wait. First off, the dedication page. This book is dedicated to my husband, Gary O'Connor. Gary, show yourself. Turn the camera around so they can see you. No, turn it so they can see you. My husband, Gary, is the Assistant Attorney General of the state of Maryland. That's what
assistant.
I like to call him the assistant, but he's actually one of many. But anyways, he's really important as an appellate attorney to keep the bad guys in jail. But also, he's edited the book. He's read it multiple times before publication to help me make sure it was understandable and that everything was written correctly. And so he is probably the world's most expert lupus lawyer that there is, because he knows more than any other lawyer in the world. Secondly, I dedicate this to my Aunt Nikki. Aunt Nikki, if you're watching this, I love you so much. My Aunt Nikki, she's been with me every step of the way since I was a little kid, brought me through really bad things in the past. She always reminds me to always remember my roots. My family, we come from literally the other side of the tracks, a place called Rabbit Town in St. Mary's, Ohio. Families don't have hardly any money there whatsoever. Families don't talk about sending kids to college. So for me to become the first person to graduate from college from my family is just an amazing thing, and I love my entire family. But I think it helps root me into understanding patients better and to empathize with them better and realize that patients with lupus are not just people with lupus, they're actually people, and I need to understand the person themselves in order to help them out. So thank you, Aunt Nikki. I love you very much. Every time I go home, she spoils me with my favorite foods like hamburger, potato, and onion patties, which come from the Depression when they couldn't afford things. So thank you, Aunt Nikki. Other things in the book, it has a new chapter on lupus in children and adolescents. And this was who helped me write this is actually the chief of Rheumatology at the Children's National Hospital. I really appreciate Dr. Sule and also Matthew Shepard, who helped me write this wonderful chapter. You know, children are not small adults. There's a lot of unique things about children with lupus. They have much more severe disease overall than adults. And so this will help the caregivers of pediatric lupus patients and the children themselves. I wrote it so that they can get things out of it as well. The entire book applies to them, but that's a special chapter just for them. Other special chapters, chapter 42 is about preparing yourself for surgery and travel. Those things are unique for lupus patients, so that's important and helpful. There's 2 online chapters. Everyone watching this can actually go there now and read it. You don't have to get the book whatsoever. One of them is for disability. So people, unfortunately, with lupus sometimes become so severely affected that they're not able to do their jobs anymore. Most people fail the disability process, have to get lawyers, lose a lot of money in the process. I give you the tools on that online chapter so that you can try to beat the system and get approval at the very first bat. Hopefully most of you are working, because working with lupus is much, much better. It gives you meaning in life. You definitely get more money than if you're disabled. But you get special rights in your job as a lupus patient, and I give you all that advice in the online chapter. Sharon Christie, who's a disability lawyer expert, and she used to be on the board of the Lupus Foundation here in Washington, D.C., helped me write that chapter. And then there's another online chapter about insurance and how to afford health care. And my office administrator, Barbara Taylor, she's wonderful, but she helped me with that chapter because insurance is so complicated. When I go on Medicare, I'm going to ask her for her help. But go to lupusencyclopedia.com. At the very top, you're going to see a little thing to click called About the Book. Click on About the Book, and then below it will be those 2 chapters, and you can look at those right now. The other wonderful thing, I reached out to the world's experts on lupus, or many of them, and asked them if they would help me with the book. And here's just a list of the contributing editors. Every single chapter has a lupus expert from across the world that helped me with it to make this version even better than the first one. This way I can make sure that it's up to date, everything is accurate, and gives the best information. And just for example, I have experts from the United Kingdom, from Crete, from Israel, and also from Canada as well. And then some of the best universities and medical centers are represented. I have doctors from Johns Hopkins Hospital, the National Institutes of Health, from Howard University, Harvard, Yale, Stanford, New York University Langone, Georgetown, GW here in Washington, D.C., and my own affiliated university where I'm a clinical associate professor, the Uniformed Services University at Bethesda, Maryland. So all of those universities and many more are represented. And then we go past the contributors, multiple pages. I think there's about 50 of them, by the way. But then I get to something called the foreword. And the foreword is right here. And I really, truly appreciate Dr. Karen Kostenbader. Dr. Karen Kostenbader was generous in writing this foreword and recommending this to people and patients and doctors to read. Dr. Kostenbader is one of the world's best lupologists or lupus experts. She's written multiple articles. All you have to do is go to Google Scholar, just type in Karen Kostenbader, and you're going to find a ton of research studies that she's written. She is a professor at Harvard, and Karen, Dr. Kostenbader, I truly appreciate your writing the foreword. So other things that are going on in the preface, this book is so huge that there's no way you can just start to read this and get and know what to do. But in the preface, you have to read this. This tells you step by step how to get the most out of this book so that you're not overwhelmed, especially if you're new with lupus. So read the preface and it'll tell you an easy way to get everything out of this book that you can possibly get. So please do that. Let's see. And then I wrote down these recommendations and such. So I have a lot of new stuff in this book. That's the great thing about the Lupus Encyclopedia second edition. And just to give you some examples, you can go to send me emails at lupusencyclopedia@gmail.com. lupusencyclopedia@gmail.com. I asked readers of the first edition to give me advice on how to make the second edition better. I read your emails and I put them to work in the second edition. Just for example, this includes those rare complications that you can't read about anywhere else. You go on Google and search for them, and it's so hard to find information. Well, you can look up those things here, such as macrophage activation syndrome. There's just a whole lot of stuff that you can get out of this book that you won't read anywhere else. There's also new classification criteria for systemic lupus. The latest one from 2019 from the American College of Rheumatology and European Union League Against Rheumatism, and it includes those criteria. This is important because those are what doctors use to help them learn how to diagnose lupus better. It has information about the microbiome, what other people call leaky gut syndrome. We have a lot of healthy bacteria and viruses throughout our body that help keep us healthy. You know, the intestines are the largest immune system organ of the body, and that immune system is constantly interacting with the bacteria and the food in our gut. And so I talk about that, and I give you advice on what you should eat in your diet to help make your immune system or your microbiome in the intestines better. You also have a microbiome on the skin that affects your immune system, and even on your teeth. And I go into all kinds of detail about what those abnormalities do and how to improve them. I also have updated information on how to get pregnant. Did you know the vast majority of our lupus patients can get pregnant and have a successful pregnancy? What to do during breastfeeding, how to have birth control, healthcare disparities, which are an important problem these days. We need more people in research of color, so please help us out with clinical trials, and I go over that in the book. COVID-19 affected our patients horribly, and I talk about how COVID-19 affects lupus patients. You know, you should hold certain drugs around vaccines. I talk about which ones to do and for how long. I have all the new FDA-approved drugs in this book as of 2023, which is the date of this particular video. I give you the best information about drugs. You know, when you pick up a medication from the pharmacy, you just get a laundry list of side effects. Many of them really don't pertain to most people, but in this book you can look up something like hydroxychloroquine or methotrexate, and it'll tell you exactly which side effects you really truly need to think about, how often they occur. That's my cat Siriway. He's a wonderful kitty. Thank you, Siriway. You can help out. Anyways, move. And then also lots of other great information, what to do during surgeries, you know, what to do if you miss a dose and so forth. Also, I go over non-medical treatments, diet, exercise, supplements, like which ones actually may help out lupus, and also other therapies like IVIG and so forth. And then the very last chapter. The very last chapter is called the Lupus Secrets Checklist. And you know, if you're watching this and don't even buy my book, please go to lupusencyclopedia.com, click on the Lupus Secrets up on top, and it gives you a list of do's and don'ts, ways that you can be successful and better with living with lupus and live longer with your lupus as well, which is very important. That's what started this book in the first place. Back in the early 1990s, I read a lot of information from some lupus experts in Du Bois' lupus book, and it's written by Dr. Daniel Wallace, who took over Dr. Du Bois' practice. Dr. Daniel Wallace is the lupus expert of the stars, by the way, and Dr. Bevra Hahn, who was the chief of rheumatology at UCLA. But they came up with this list of things that patients should do other than just taking medicines. So I've expanded on that over the years, and I made up the Lupus Secrets. Thank you, Dr. Wallace and Dr. Hahn, for spurring me to do this in the first place. And then finally, one last thing. I love being a doctor because I get things like this all the time. This is an actual thank you card for one of my patients. I want to talk about this just very quickly to end. This particular patient, I've taken care of her for over 20 years. She does everything on my Lupus Secrets. And then one day, I saw her a few years ago, and she had a horrible flare of her lupus, lots of arthritis and pleurisy. And I put her on steroids in just a short course. I gave her a shot in the butt with steroids. And then her lab showed that her hydroxychloroquine drug level was very low. And I asked her, why are you not taking your hydroxychloroquine? And she said, you know, Dr. Thomas, the pharmacist, he put a label on the bottle to always take it with food. And I said, you don't need to do that. Food can make it easier on your stomach, but you don't need to take it with food. She started taking it religiously. She's been in remission since then. Let me just read you real quick what she wrote in the card. And this is her handwriting and what she wrote, but I'll read it to you real quick. So it says, just want you to know, Dr. Thomas, that I highly respect you as my doctor. I've never really had that talk about making sure not to miss my Plaquenil medication. I thought I really had to take it with food, and I would sometimes forget to eat, and I would put it to the side and forget to take my medicine. This has been a wake-up call for me. And I really enjoy having you as my doctor. You really care about your patients, and I really do. But God has kept me here with you because of your help, and I want, she says, I want to live a long time. No one in my family has lived past 60 years of age. She comes from a family with multiple cases of severe lupus. No one's lived past 60 years old, but you know the neatest thing about this card? She was 72 years old when she wrote it. She's lived much longer than anyone else in her family simply by following the lupus secrets. And so I hope that, and today she's over 75, so I hope you follow her footsteps. Please consider getting my book. Follow the Lupus Secrets. Get it for your loved one. If you can't afford it, like if you're a teenager in your early 20s, please go to your library. My first edition is about almost everywhere, and there's also very cheap used copies on the internet. And then ask your local library to get the book and have it there with you for you to read. But if you learn to do the Lupus Secrets, you'll learn to live with lupus better. You'll live a much longer life, and you can learn to conquer lupus and not let lupus conquer you. Well, thank you very much for listening to me.